put it here.
So,
For
good
the camera.
afternoon. Wow, it's full house. Thank you all for coming. So, today's seminar is really special. We're going to discuss the issue of the industry interference in the NCD epidemic in general and how they influence public health, research, policy, and practice. So, currently, NCD is recognized as a global health challenge and more so in Lebanon because it's the leading cause of death. However, there has been an international recognition about the role of the industry in the NCD epidemic and actually the production of unhealthy commodities, pouring a lot of money in the marketing strategies for those unhealthy commodities, and then trying to influence the policy making process to stop any kind of interventions or policies to stop the industry work. And then definitely they've been trying to infiltrate the academic field, trying to influence researchers and academic institutions. So with those kind of interactions happening with researchers and policymakers, conflict of interest always arises. And unfortunately, this concept is not yet well grabbed in our context. So that's why we're hoping that this panel discussion would highlight those important issues. Luckily, we have panelists who are experts in the issue of industry interference and conflict of interest. They're currently here in Lebanon for a meeting for the JESSI network, JESSI PH network, which is an international network of researchers, experts, and advocates working on issues related to governance, ethics, and conflict of interest in public health research. So we kind of had this opportunity to hold this panel discussion. The Delta Omega Association, along with the Faculty of Health Sciences, supported in holding this seminar. So quickly, for those who don't know, the Delta Omega Association is a public health honorary association with more than 112 chapters worldwide, and actually only 6 chapters are outside the US. And Lebanon chapter, the FHS chapter, is the only one in the region. So our mission is actually to promote public health research and practice. We induct students, faculty members, and alumni yearly to the chapter as well, and we conduct multiple public health activities. Next week, actually, we're launching the Public Health Week, so please follow us on Twitter, Instagram, and Facebook for the Delta Omega Association to know more about our work. I'm Rana Saleh, for those who don't know me. I'm the Advocacy and Evidence Lead Specialist at the Knowledge to Policy Center at the faculty here. And I'm a member of the Delta Omega Association and also a member of the JESSI PH network, and I'll be facilitating this seminar. So I'm going to start with a quick introduction for the panelists. We have Dr. Angela Carrieto. Dr. Angela has recently awarded with a PhD on public health and policy at the London School of Hygiene and Tropical Medicine, where she also obtained her master's degree in public health and nutrition. Her PhD research focuses on policy analysis of the Mexican soda tax. She has conducted or co-authored several publications on food and nutrition guidelines, food policies, global health governance, and the influence of non-state actors on nutrition policy making, and definitely conflict of interest. Currently, she's a consultant for the National Institute of Public Health in Mexico and the World Health Research Fund International at the UK, and she's currently a part of the World Public Health Nutrition Association Executive Committee. Dr. Ili Aal. Dr. Ili Aal is a tenured professor of medicine at the American University of Beirut. He leads the Division of General Internal Medicine and Geriatrics at AUB-MC and directs the Clinical Research Institute and the AUB Grade Center. His research expertise is in systematic reviews, practice guidelines, and conflict of interest. He published more than 330 peer-reviewed papers and was listed by Reuters as one of the 2015 world's most influential scientific minds and as one of the highest cited researchers from 2015 up to 2018. So Dr. Niam Fitzgerald. Dr. Niam is a senior lecturer in alcohol studies at the Institute of Social Marketing, University of Stirling. She's a lead on teaching and public engagement on alcohol for the UK Centre for Tobacco and Alcohol Studies since 2014. She's currently the president of the International Confederation of Alcohol, Tobacco, and Other Drug Research Associations. Current areas of research interest focus on the evaluation of alcohol policies, arguments and framing in the alcohol policy debates, alcohol in pregnancy, and management of conflict of interest. Last but not least, Dr. Leslie London is the chair of the Public Health Medicine at the University of Cape Town, South Africa. He has degrees in medicine, public health, epidemiology, and professional specialization in public health medicine. He is also the president of the College of Public Health Medicine in South Africa and is an active researcher in the field of public health policy and environmental epidemiology. He leads the Health and Human Rights Program in the School of Public Health and Family Medicine and is an active member of the global NGO People Health Movement. So please join me in welcoming our panelists. We're gonna quickly start with the first round of questions, and then we're gonna open the floor for questions from the audience, and then we're gonna go for the second round of questions, and then questions from the audience. So I'm gonna start with Dr. Niem. Dr. Niem, we know that DHO has been very active in Ireland. Can you tell us more about their activities and what they've been doing there?
Sure, thank you. So if I could get the first slide up, please. So I'm going to tell you a little bit about what has been happening in Ireland and a particular initiative that was funded by the industry there. So Ireland is a very small country. We're going to get a slide up, I think, in a minute showing you where it is. It's about 5 million people. It's famous for music and literature, St. Patrick's Day, and next one, please. Yeah, so this is where we are. And we're famous for alcohol, specifically Guinness. Guinness is a world-leading brand. It's positioned as a global symbol of Irishness, so much so that even dignitaries and visiting royals are happy to be pictured drinking Guinness. In fact, they pose for these photos as a sort of demonstration of their solidarity with Ireland. But this hides what is in fact a massive alcohol problem in Ireland. So our per capita consumption is 11 litres of pure alcohol per year. And just in terms of what that means for our health services, it's estimated that our publicly funded health services spend about 12% of their budget annually on alcohol-related illnesses and presentations. And they are very overstretched, so that's a particular problem. So into this mix came this campaign. It was called the Stop Out of Control Drinking Campaign. And it aimed to change Ireland's culture of drinking for the better, and very specifically aimed to make out of control drinking culturally and socially unacceptable by 2021. The campaign included a Facebook page, a website, a Twitter feed, and it invested in a series of radio and television adverts. It had a budget of about €1 million. It was chaired by this guy who was the head of one of Ireland's leading children's charities. He chaired the board which managed the campaign, which I'll tell you a bit more about in a moment. So the campaign itself, the adverts focused on parental influence, binge drinking, and seemed to have a disproportionate focus on young women's drinking, although that wasn't a stated aim. So the campaign was entirely funded by Diageo. It had an independent board. I'll come back to that in a moment, but Diageo is one of the world's largest alcohol companies. They were, up until very recently, the largest spirits producer in the world, and they also own Guinness. So Guinness is not the lovely, small, cosy Irish brand that you might think it is. It is actually part and owned by a multinational corporation. Their slogan is celebrating life every day, everywhere, which I guess is a way of implying that you might want to use one of their many well-known brands, every day, everywhere. But the campaign board was ostensibly independent. So they very vociferously said that they were an independent board. They said, we are funded by Diageo, but nobody tells us what to think. And it included some very well-meaning people. So very well-known psychologists, a family doctor who was also a kind of TV personality, and several people from charities and NGOs. And those people weren't paid for their involvement. They formed what was said to be an independent board, although up until about 1 month into the campaign, one of the senior executives at Diageo was also a member of the board of the campaign. So, who cares? Well, I guess one of the things is that the campaign had a design flaw, we believe, right from the start. So, with Professor Mark Pettigrew at London School of Hygiene and Tropical Medicine, we analysed all of the publicly available material from the campaign and their media output and interviews. And I suppose what we found is that out of control drinking is, I think, fairly easily recognisable as a term that means very little to anybody. Nobody thinks that they are an out of control drinker, because there's always somebody who's more out of control than you are if you're drinking. And in interviews, the people on the board struggled to define out of control drinking, or refused to define out of control drinking. And they said it means different things to different people. And when they were asked about, say, for example, guidelines like World Health Organization guidelines or government guidelines on low-risk drinking, they sort of didn't endorse those guidelines, and they said that it was really about behaviour. So you would know by your behaviour whether your drinking was out of control or not. It wasn't about the amount that you were drinking. And then the second issue was that the causes of alcohol harms were presented as psychological, cultural, the result of parent problems or peer influence, rather than a result of poor governance, low levels of regulation, or industry, marketing and advertising. So in contrast to the £1 million that was spent on this campaign, Diageo's estimated marketing budget in Ireland is €1 million per week, not just for one campaign. So it's society's psychological motivations that are the cause of alcohol harms. So that was one problem that we saw with it. The second aspect of the campaign that was problematic, and I'll finish here, is that alongside the campaign, they ran a kind of public consultation process. They invited people to come along to public meetings to express their opinions and experiences about what the solutions were to Ireland's alcohol problem. And this, I think, can really only be interpreted as an attempt to have a kind of parallel policy-making process, because at the same time as this campaign was launched, there was a very strong alcohol control law going through the Irish Parliament, and that included controls on pricing, on advertising, and on labelling of alcohol products. None of those interventions were really mentioned or supported by this campaign. And so the second main problem with this, I suppose, is really sort of it operating in a way, developing an action plan that is a kind of parallel process of policy making that can only be, I think, seen as being an attempt to distract from or undermine the legitimate policy making of elected representatives. So I'm going to stop there. That was the Diageo-funded Stop Out of Control Drinking campaign in Ireland.
Thank you. That's very interesting. So, Dr. Leslie, can you tell us more about the activities of Philippe Morris and how they've been trying to infiltrate and influence academic institutions and researchers in South Africa?
So thanks very much. So I was struck by Neith's comment on out of control, because in a way this is a different kind of out of control. It's institutions being actually out of control, not having control themselves. So my case is slightly different. It has a bit of a background. So I'm going to trace it back to South Africa has quite a strong history of tobacco legislation. We've reduced the prevalence of smoking in young people after quite strong tobacco restrictions, even before the convention was in place. But of course, not much had changed that well, and the electronic tobacco delivery system devices have emerged. And I'll give you a bit of background to the case. In February 2017, I was speaking at a meeting hosted by the Foundation for Human Rights on the National Health Insurance, and one of the other speakers who, while we were in the car, started asking me, well, would I be prepared to go to a meeting to discuss health implications of e-cigarettes? And this other speaker was the former president of our medical association, a very charismatic leader, currently the head of the equivalent of the General Medical Council in South Africa, essentially a person with quite considerable power. I subsequently learned he was basically recruited by the Foundation for Smoke-Free World to lobby support. I, of course, declined participation. Then 2 months later, a colleague of mine at Wits University emailed me to say she'd been approached by a consultant of the tobacco industry who commented about her sort of social justice, human rights activities, said, oh, fantastic, you're doing that, it's really good. But then he asked her for a meeting to discuss new research findings on e-cigarettes. So I advised her to decline the meeting, but she did. Then in July 2017, the same consultant approached our university. The administrator at the time, everybody else was on leave, and she didn't think twice. She just said, "Oh, you must speak to Professor London." So I get this email, and the consultant says, "I'm a UCT graduate. I worked at UCT's Industrial Health Research Group, which is a very progressive trade union-linked NGO doing health and safety work. We did work there with Johnny Myers, and this was my former head of department and a colleague. I now consult the tobacco sector on a number of matters from sustainability to regulation. The sector has developed new generation products designed to be less harmful and is keen to meet with medical scientists in South Africa to discuss the principles and science of harm reduction." So in his introduction, he kind of makes his name drops, and he makes use of his left-wing credentials to try and get entry. And of course, my response to him is I won't meet with him because Philip Morris has lied systematically over many years and has suppressed evidence of tobacco harms and is a known record of corrupting science. Then, a year later, in September 2018, our University Research Office sends out a call for proposals from the Foundation for a Smoke-Free World. There's an outcry, and the university officially withdraws the call, and the Director of Research at the university says, and I quote, "We are retracting the funding call notice immediately. It was included as part of a roads exercise whereby we post information on funding opportunities, and this one regrettably slipped through. Please accept our apologies for the inconvenience caused." So that's the context. So the case is actually then happens on the very same day. A colleague of mine, Amina, who's in the audience here, sends me an email telling me that the Graduate School of Business at our university is co-hosting a seminar with Philip Morris. And there's a URL, so I go to the website, and there's the picture behind me. So it's quite clear. No, that's actually the wrong one. That's it. So it's quite clear that it says in partnership. Oh no, sorry, that's the wrong one. First one, yeah. GSB in partnership with Philip Morris. And so it's co-hosted and it's presented under the title Technology as a Game Changer. I discovered that the GSB staff member who's chairing the event has the same surname as me, a North American faculty member to whom I'm not related, but he's also bald and bearded and male. And I discovered that one of the other speakers, an associate professor of marketing, had the previous month published an article in an online newspaper in South Africa titled "Nudges, Not Nanning, Needed If We Want to Change Consumer Behavior." In that article, he argued that educational campaigns or nudges had been successful in fighting the spread of HIV, claiming that over the last few years, the number of new infections has been consistently declining, and this has nothing to do with the law. Therefore, such an approach in attempting to reduce the consumption of alcohol, tobacco, and sugary drinks could yield similar results. He doesn't present any evidence to support this claim in the article, and we know, of course, that that's not borne out by the published literature. The article ends with an announcement of the GSB panel discussion on disruption in the tobacco industry next month. So it's set up as a partnership between the university and Philip Morris. And at that point, I'll pause.
Okay, thank you so much. So I'm going to move now to pharma interference, and I'm going to ask Dr. Elia. So given your work experience in developing evidence-based guidelines, so you've established special interest in pharma interference and with physicians at level. Can you tell us more about this?
So then I'm going to disappoint you. So the case of pharma is different than the other cases because pharma deal with physicians, and as physicians we have the oath of Hippocrates that we do the best for the patient. So nothing bad happens with pharma. I wish. Okay, so can you please? Okay, so I'm going to talk about the interference of pharma with the practice of physicians, and then I'm going to talk a little bit more about the interference with the with the research enterprise. So let's start with the first one in terms of practice. Okay, so we started with the Spark team with the priority setting exercise a few years ago, and Pharma came up as a priority issue for the stakeholders we had engaged. So we went on and set up a research agenda. So it started with a series of systematic reviews so we would understand what's out there and to form the basis for our local research. And we ended up publishing, I think, 5 or 6 systematic reviews. And so far we've done about 4 or 5 primary studies, most of them qualitative research, and I'm proud to say that were led by our medical students. So let me tell you the one, yes, so we move to the next one, please. Yeah, the big question, does the interaction with pharma affect physicians' behavior? And the next slide is a meta-analysis of a number of studies that have looked at this question, and the obvious answer is yes. So physicians who are more likely to interact with pharma are more likely to prescribe medications that are not in line with the standard of practice. So prescribe medications that are not in line and prescribe to a wider number of patients. So the answer is clear. So yes, interacting with pharma affects how you behave. And then the question is, what is happening locally? So this is actually, I put this this paper because this came out after our paper. It has the same message. It came out in the lay press. So this is not confined to a peer review paper. Now this kind of message is getting out to the public. So public is more and more aware of how the interaction with pharma is affecting their own physicians' behavior. So when we did our local study, it was a qualitative study where we interviewed physicians, pharmacists, and drug reps. We came up with this conceptual framework. The main message is that these 3 groups interact in ways that are a bit frightening. So you have the pharma company on top that interact with physicians, they give them education, which is supposedly a good thing. They promote their drugs, but they also give them incentives. Incentives for what? To promote their drugs. So same thing happens between pharma and the pharmacist. So pharma, the drug reps go to the pharmacist, they give them incentives. I'll show you what these are. And what do they get in return? Any idea? They get intelligence. Whether the physicians in that building is prescribing the medication he got or she got the gift for. So actually the drug rep is able to go look at the prescriptions and identify what the physician is prescribing. So think about the ethics, privacy of patients, and all the problems. And then just before this one, physicians and pharmacists in some cases, there are mutual referrals, but one main theme is the blame of the other. So the physicians blame the pharmacists blame the physician blames drug reps. It's a game of blame. Okay, what are the incentives? Anything you can imagine or dream of. Actually, when I present this to the patient, I tell you, when you become physicians, you have all these benefits, and they get more excited. So incentives to, let's start on the other side. Incentive offered to, so on this side, to physicians, actually. On this side, so they get stationery, that's the basic thing, office equipment, office furniture, travel. Office furniture could be an AC. You know, I need to get a new air conditioner for my clinic. Travel is kind of standard, unfortunately. Cash, they get cash. Textbooks, sponsored conferences, free samples. Unfortunately, in some cases, these physicians go on and sell those free samples. Electronic iPads, you know, the kids need an iPad. That's true. Paid key speaker positions, research, financial, sexual favors, local retreats, boat trips, these are real examples, and paid TV speakers. So usually people get interested in this part, not sure why. So sexual favors is actually, in some cases, like, you know, direct sexual favors, but sometimes an interesting story that we got from more than one source. As you know, when you do a qualitative research, you might get a quote, but then we got it from 3 sources, is that when they get the physician, they send them to Prague or somewhere nice for a 30-minute conference, and then they have a 3-day to spend. So they give them a debit card with $500, they go, and at the end of the day, At the elevator, they ask them, do you want us to send someone to the room? Very sad. Another example, they say the first time they send the physician, the second by himself or herself. The next time they send the physician with his wife, and the third time with his girlfriend. It's just total corruption.
How about business class? Upgrade to business class.
I'm sorry?
Upgrade the business.
Yes, of course. We can do that for you. So you see, there are also incentives to pharmacists in all kinds of ways, and to pharmaceutical representatives. I don't want to spend more time than I'm allocated. I think one interesting feature of all this is that things are much worse with local companies as opposed to international companies. So as you know, international companies now have standards and rules after all the stories that happened internationally. So these rules and standards kind of trickle down to the local branches. However, unfortunately, the local companies have learned the tactics, but they have no control. So they are the worst in terms of using these tactics. I just wanted to show you that it's in the news, so it's not in the peer-reviewed papers. So this is in the Guardian. On the next slide, you will see that they specifically mention the sexual favors. So it's not like a secret. So this is another news. So this is business news mentioning the Middle East, and this is a local newspaper. And the reason I'm showing this is because we did another study with patients about the trust in physicians. And we kind of expected that the major factor that would affect the trust in physician is medical errors. Because recently in Iran we've had many cases of highly publicized medical errors, people who had very negative results, and we did this around the same period. What they said, they are willing to accept medical errors as long as they are not fatal. They accept that this is part of the system, but what they do not accept is physicians to be financially driven. Okay, so the next slide is about the interaction or how drug companies or pharma tries to affect the research enterprise. So what kind of relationships pharma try to establish? That was supposed to be a question, but yes. So this is attention test. So what are the types of relationships that pharma establishes, or with who, to affect the research process? I'm sorry?
Advocacy group.
Yes, advocacy group, front groups. This is unfortunately very common. Yes, academicians and universities, definitely.
Ministries who decide on vaccination.
Yes, policymakers. So let's look at the list. So first they fund research. This is the most direct way. Advocacy group, 75% in one study of advocacy groups, I think for cancer, were paid by pharma. Funding agencies, they partner with them. Experts in the field, this is extremely common. You have experts in the field that sit on the guideline panel and they're being paid. Professional organizations, regulatory agencies like the FDA, in some cases 75%, I think in one study. Reviewers for drugs being approved by or reviewed by the FDA were funded by or were paid by the industry. Health institutions, we mentioned that. Practitioners who see patients. In some cases, they try to infiltrate processes to affect standards of research. So this was observed actually with tobacco and standard how to measure TAR, and direct-to-consumer advertising and how they use research to affect that. So the next slide is the level of this influence. So these are the different steps of the research. They aim to affect all of these. So the next slide actually shows the matrix, who they try to affect, all these groups you mentioned, and the different steps of the research, going from prioritization of the research question to planning of the study to conducting the study to dissemination. And if you have the mind of pharma, you would look at this and say, I want all of this to be checked. And this is what they try to do. What we have checked here is what we thought is currently happening. Thank you.
That's a lot. So we've seen seen the interference of the industry in alcohol, the alcohol industry and the tobacco industry and the pharma in research, in policy making, and in practice. Now moving to the food and beverage industry, which is the less spoken about and less discussed actually. So please, Dr. Angela, let us know about the food and beverage industry activities in Mexico and what they've been doing lately.
Okay. Hi, thank you. I will try to be brief, but this case obviously is around the whole policy making of the soda tax, how it came to be a solution to a problem and how it was implemented and what were the strategies used before, during, and after the tax was effective. So for those of you who don't know, Mexico has a big problem of obesity. We have 72% of the population with overweight or obesity. 36% of the children are overweight or obese. And we are, at some point we were, I think we have some high competitors of sugary drinks consumption, like around 162 milliliters per person per day. So we reach a very high consumption of sugary drinks, beverages in the country, and that also has to do, I have to raise these, and it came out on my results. We have a very big problem of water availability. Free drinking water is not a given in the country, so that has to do a lot with the context for this problem. So I present here in this complex slide, what I just is how the process of the policy. It started in 2012 with a proposal Senate in the Senate from the Senate, and this person, this congressman, was presented and it was rejected. But at the end of 2012, there were also elections for the president. So what happened is that the president, coming from the Ministry of Finance, adopted the policy. And they came to the senator and said, okay, we're going to take your proposal that was rejected and use it, and it will come from the federal government. So that's exactly what happened. Of course, this senator had a lot of strategies we already know, lobbying, big lobbying. There were relationships with other congressmen in her party and outside her party, so she couldn't pass the proposal in the first attempt. So then the federal government adopted, modified it. It's like a black box. What happened there? Because the original proposal was 20%, and it came out 10%, one peso per liter, but it's more or less 10%. So it came through the Ministry of Finance. At the beginning, the Ministry of Health was silent to this problem, and obviously, by looking into things, there was a relationship of the Ministry of Health with corporations such as Nestle, because by doing this analysis, this is part of my research, we see that a lot of relationships between actors. So here, the groups I have in pink the industry, in blue the government entities, and in green the civil society, and front groups in purple. There were a lot of interactions, but one of them was that the Ministry of Health was influenced by the food industry. So during the whole process, there were many activities by all these actors. For example, public polls, marketing campaigns, creation of front groups, public discourses, media and journalistic publications, and obviously different type of framing the problem and framing the solution was a big issue at the time. For example, you have here. Here you have this is the senator who presented in 2012 the initiative We made some policy briefs. A big group of advocates were supporting her, and we all got funding from Bloomberg Philanthropies, and that was one of the main arguments that industry used against the proposal, that it was the Bloomberg tax. You must have seen it in the news. People who follow. And these were the efforts that we were making to promote the tax throughout the discussion before it became effective. This is social marketing campaigns, like how much sugar is in a drink, what can you do with the revenues, like provide water, etc. So finally, in October 2013, the president also implemented the obesity strategy, an obesity strategy. So the soda tax was framed both in the Ministry of Health fiscal reform and in the obesity strategy. So it was, let's say, it came from different fronts, but and was used to frame for different reasons. So that's really important. After that, we see that the reaction of the industry was really heavy, because the president presented this in October 2013, and the proposal of the soda tax was voted in December. So there was a lot of media coverage on the issue. So here we can see that they pay public campaigns to promote that they were not being effective. For example, in a newspaper they say, Coca-Cola, we offer 40% of our products are low in calories, so you can make a really informed decision. And then it says a little bit of flavor with sugar is good for you. So these are the consortiums of people, consortiums of corporations getting together, building coalitions to go against the tax. Obviously, the arguments were obviously the right of free choice versus the right of health and access to water. The tax is regressive, affects the poor people, threatening jobs, lack of effectiveness. During the process, they were lobbying policymakers, they were having public campaigns, statements and coalitions with consortiums and federations, including the Diabetes Federation in Mexico, and outrageous some other relationships that you can look in detail if you're interested in some documents. Framing impact of the soda tax within precise and confusing language. This is, for example, one of my findings. I framed here like red, yellow, and green. And this is the type of funding these institutions got to report on the soda tax effectiveness after a year. So the National Institute of Public Health was having money from Bloomberg. The Universidad Autónoma de Nuevo León was having money from the Beverage Consortium and Prague. And ITAM was having money from ConMéxico, another consortium of food and beverage industries. So here, I don't want you to go into detail, but mainly the language they used to report the effectiveness is confusing, and they were trying to use terms like calorie. The tax did not change substantially the median caloric intake. So if somebody reads that, you say, what is that? Or the quality of calories. And if you're a nutritionist or you're in health, you see that this is kind of weird language. So this is the main thing. They were framing differently the effect, because at some point the tax was voted again to be increased. They wanted to be like a progressive tax, like the tobacco tax, to become higher with time. And this happened in 2016 after the tax. So many other things happened. For example, the industry got involved in the monitoring strategy the government set for evaluating the policy, the soda tax, the labeling, and other regulatory measures they took. So in the board for monitoring and evaluating the policy, there was most of the participants they invited as a multi-stakeholder solution were related to the industry. So you can see, I'm not doing it. Sorry, here you can see that even they say they were inviting academics, industry, civil society. Most of them had links with the food and industry organizations. So it was quite biased, and in the interviews they didn't get anywhere in terms of measuring the impact of the solar tax. Another strategy and another thing they did, they had media lobbying, and this was really stressful at the time when advocates were also pushing for the 20% tax. They got a spyware in their phones. They got spied. So the links were sent to people in the institute, to people in the advocacy groups, and they were in basic form of spyware developed by some groups in Israel and that have been bought by governments in other cases. The whole case is reported in the New York Times, and you can look for it. It's really interesting and preoccupying. So here's the piece in the newspaper. Also, other strategies they got, like, this is hilarious, they got involved also in PPPs to improve access to water. So you can see these are the water fountains in the schools before, like a long time when we were doing another project. And this is what they are doing now. They are doing hydration centers for the schools. So they are partnering with the government to provide water in schools and in parks, etc. So it's quite, they reach 1,500 schools in the first year. So they are partnering with the government. They are doing social responsibility actions with minorities and low-income groups. Also, in regards of access to water, they have expanded their market and intimidation of the advocates, as I say. So these are some of the main. So these are some of the main issues. And the final thing that is also hilarious is after the tax, they agreed with the president that during his mandate, they won't increase the tax. And just after that, in 2016, the president went and opened this research, Coca-Cola Innovation and Development Center. There you can see the president, the global head of operations of Coca-Cola Company, and the Ministry of Health together. And they say they want to be part of to support and sponsor the water fountains and to promote research. So all these inconsistencies came along throughout the whole policy, let's say, story, or so that's really important to consider whenever you're in this area and promoting a policy. To be careful. Thank you.
So is it just me, or they're using like the same? So is it just me, or they're using the same strategies across different industries? So it's important to acknowledge that they're using similar strategies, but yet we need to identify what counter strategies are needed to act upon those strategies. Unfortunately, for the sake of the time, we won't have except one round of questions. So we're going to move from the audience. So we're going to move directly back to the panel panelists to ask them about the counter strategies, what they did in their cases, and how to overcome the activities of the industry. So I'm going to start with Dr. Miriam.
Thank you. So I am based in Scotland, I'm not based in Ireland, so I'm going to describe just a little bit about what happened. So there was a large media outcry at the hypocrisy of Diageo in sponsoring this campaign to reduce drinking, whilst at the same time promoting drinking at every opportunity. And that, I think, was primarily what led to resignations from the board, so starting with the Diageo representative himself, followed quite quickly by the family doctor, one of the psychologists, and a couple of other people. I think that was really helped by a general sense of public anger at corporations following the financial crash, which left Ireland bankrupt, basically. So I think there was a general sense of, we don't want big companies coming telling us what to do. That probably helped to. The campaign then just really sort of died out. They published an action plan that had, super industry favourable language and nothing effective in it. Still didn't talk about advertising, but that was really quietly published. There was almost no publicity. And I suppose in terms of what could be done, I think there's a real need to understand how good people, well-meaning people in civil society in Ireland and other places can be so easily fooled by a campaign that just by looking at the name of it, I can go, well, there's no way that's going to be an effective campaign, and not recognise the problems with it. Like, how can we be better prepare civil society to be resistant to being so easily duped?
So also quickly in 1 minute, can you give us like your final recommendations for the students, for the researchers, for the practitioners in the room? What are your recommendations to avoid conflict of interest and to avoid industry interference?
So I think you have to think about it a lot. I'm not sure you can ever completely avoid conflicts of interest, but paying attention to language is one of the things that I feel is really important. So how is the person approaching you for a project, describing the problem? It's very different to talk about out-of-control drinking compared to talking about the problem being an alcohol-saturated environment. It leads to very different solutions. And I suppose looking outside the narrow, direct impact of whatever it is the organisation wants to fund, thinking about, why are they wanting to fund this? What is the benefit to them? And might that benefit in terms of usually influence and reputation outweigh any good achieved directly by the campaign? I mean, this particular example should have been really simple to recognise because it's a very obviously ineffective campaign. Sometimes what industry want to fund is something that may not be obviously bad or do some good in that sphere, but may still overall cause harms at a system level because of the reputation and influence that it buys them.
Thank you. So Dr. Leslie, what did you do in your case? What can be done to counteract the strategies and your recommendations?
Okay, so here's a Philip Morris collaboration from the university. So the next day I write to the Dean of the Faculty of the GSB, Creative School of Business, citing the health risks of tobacco and the track record of the industry having misled the public, and comment that this is not a game changer, but this is a profit protector. So the email is copied to the senior management in our university, the senior management in our deanery. It's sent to colleagues who actively outfit on tobacco research, both at UCT and elsewhere in South Africa, urging them to write to the DBC. One colleague writes to the Vice Chancellor pointing out he's due to go to the WHO meeting on the commemoration of Alma Ata, and he might not be able to go now that the institution's accepting collaboration with the tobacco industry. And I also write to international colleagues, including the Jesse Network, to mobilize emails to the university to abandon the seminar. So the Dean of the GSB responds early next morning, and he's very forthright. He says, "I was unaware we had agreed to this. You present the case, it is not a good business decision to associate our brand with this. I agree with the argument you make. I will ask my colleague to bring us up to speed on the set of events or decisions that have led to this, and importantly, how we can extricate ourselves from this situation." So that's 8 o'clock in the morning. The lecturer, who has my name, responds about 9:30, gives me an elaborate and very long-winded explanation how he had nothing to do with organising it. He only agreed to chair it if certain conditions were met, and obviously those conditions were no money was exchanged, blah, blah, blah. Claimed it was an opportunity to get beyond the marketing hype and interrogate issues at the heart of what the GSB is about, i.e. interrogating business's role in society and encouraging business leaders to consider more than just profit. So I responded about 45 minutes later saying I was pleased he was skeptical, but I was not really able to understand how there was a clear partnership advertised for which no explanation was provided. Then mysteriously, I wonder if you could put up the next slide. Is it gone? Mysteriously, about 20, I don't know why I took a screenshot. I took a screenshot at 12:15, and then like half an hour later, the next screenshot appears. The web pages of the Graduate School of Business that are advertising the same seminar are transformed from one where UCT and Philip Morris were advertising it to here, this one. So UCT is advertising a technology game changer seminar, and they've invited various people, including Philip Morris. Just happened to be invited. And so their role is really hidden. So I send an email back to the lecturer saying, this is very peculiar. So the dean then cancels the seminar, and then the marketing manager comes back with a very specious argument about a serendipitous meeting with Philip Morris. The dean also promised to follow up. I haven't heard from him since, but the Office of Research Integrity at my university contacts me to say they've developed a draft position statement on tobacco industry funding for comment. It's essentially banning any tobacco industry funding. I make comments, it goes off into the system. I haven't heard it since, so it's been processed. UCD's also become a tobacco-free campus prior to this, but after AUB became a tobacco-free campus.
Okay, so obviously the reply to the arguments they use have been used everywhere. Obviously, obesity and diabetes are also regressive. Sugar drinks are not necessary, etc. But mainly to the actions, I think the main thing is the civil society was very strong. It's important to have strong coalitions in the civil society, shaming as the New York Times and reporting all the actions of intimidation and interference was very important. The leading group was El Poder del Consumidor, so you know them probably, and it was the civil society that was leading all these actions, including demanding accountability to the government office or the revenues, and increasing awareness of these practices through peer-reviewed research and through other means. That were the reactions. The recommendations?
Yes, actually we have a class waiting outside, so if we can move
Well, the
very
main
quickly to
recommendation
that.
is don't oversee the loopholes of certain regulations because they will be influenced as well through the process and after having the legislation. So we really need to get careful of how these loopholes might be attacked.
I'll make it very brief. One thing there are lots of studies about what could affect physicians' behavior in terms of pharma, not much evidence in favor. One thing we learned from the qualitative study, and that I feel affects physicians when I tell them the detail. Apparently, pharma classifies or categorizes physicians into 3 categories, A, B, and C. So A, the physician that is a high prescriber of their brand. C is the person who does not deal with them, and B is the person in between. So every physician is walking with a big letter above his or her head. And what's interesting is that drug reps, when they need to see a patient or they have a family member that needs to see a patient, they send them to physician C. They never send to physician A. And that makes an impact on physicians when I share them. Thank you.
So thank you so much. Great to raise awareness around this issue. Sorry we could not have questions from the audience, but